Another one that came up that you could really cut down on is elective surgery, which a lot of people think is synonymous with unnecessary surgery. Or,
Yeah,
but what?
it's a very poor term. Um,
Yeah,
I mean, the elective surgery just means that it's not emergency surgery, but it still needs to be done. It's a term that really can confuse people. But when you're looking at the public sector, for example, when they produce the figures on waiting lists, what they're not telling you is how long patients are waiting before they even get on that list, waiting to actually see a specialist. So you can basically double the waiting list because there's a huge wait for patients to even see a specialist. And that's starting to happen in the private sector. I mean, my own husband had to wait 3 months to see a urologist, and he's on top cover. So, and that's, again, I think a result of the pandemic. A lot of doctors have said, oh, I'm not going to work 5 days a week anymore. It's just too hard. I'll work 3 or 4 days a week. So that's had an impact straight away on their waiting lists, which before was unheard of. If you were referred to a specialist, you'd usually be in a couple of weeks. There's also a shortage, particularly ENT, and paediatric ENT is a real concern of mine. I've been interviewed about it several times. Children needing grommets, which is a very simple procedure. I had a service at my first day hospital, a concession service for public patients, and those children will be in for 60 minutes and would be life-changing for them. Because if they don't get it when they need it, then their speech suffers, their learning suffers, and there are children on the public waiting list that have been sitting there for years. So that's a real concern as well. And our sector could be addressing that. But one of the problems is there's not enough ENT surgeons to actually do the work. So that's another issue. And we're not quite sure why that is, but yeah, that's one specialty that in particular that's really suffering. Maybe interestingly as well, there are new specialties emerging in the day hospital sector. One is pain management. So that's becoming quite common, and there are quite a few new day hospitals under development in pain management. We'd like to see more mental health. There's only a couple that are purely day hospitals. A lot of mental health conditions actually get worse if you hospitalise them over a long period of time, particularly conditions like borderline personality disorder. They're much better if they're going home to their familiar surroundings after treatment in a day facility. Sleep studies, much better environment to be doing that sort of activity rather than in a busy overnight hospital. And of course, there are some medical treatments that work really well in day hospitals, oncology and radiotherapy, and the ICON group are a large group of hospitals that are members of ours, and also dialysis. So the dialysis treatment is usually done in half the time, and means that patients can get back to their work or their usual activities much quicker. So it's not only surgery, so medical treatment as well is emerging in the sector, but we need to see a lot more of it.